Hi, everyone. This is Jared from Paws Saving Paws. And today I'm really excited. We have with us today Dr. Lucette, a veterinarian, international best-selling author and educator. And she is going to share some of her stories and really give us the inside look from the vet side and the rescue side where we don't see it as much. So first, I want to say, Dr. Lucette, thank you so much for spending time with us today.
Absolutely, my pleasure.
Yep. And if you could give an intro so people know who you are.
I own my own. I've been a veterinarian for 31 years. I own my own practice for 22 years, which I sold 2 years ago in 23. And I've been doing relief work some, and also so I fill in some at general practices and emergency clinics. And I still love emergency medicine. I did that before I had my practice,
Right.
and I speak. I actually speak on mindset and how to live an extraordinary life, how to live from the inside out, which I've learned from my experiences being a veterinarian and a business owner and some of life's big challenges that have come my way. And a lot of what I've learned from animals as well and
Sure.
their resilience.
Yep. Yeah, no, that makes perfect sense. Take me back to the time when you knew you were going to be working with rescue dogs, a veterinarian, or like when you knew whether it was a dog, a cat, whatever it might have been at that time. Take us back to that time.
Well, the funniest thing is that my dad was an equine veterinarian. And so my brother and I used to like to go on calls with him occasionally because he was gone a lot and traveled a lot and did, emergency stuff. And so we didn't always see a lot of him. And I went on a call with him when I was 8. And it's funny, I'll be careful to say this so it doesn't sound too, gory or anything, but he went to a horse that had reared up and it had cut its nose like all through here, through its both nostrils, all the way on a tin roof of a shed, and it needed to be sewn up. Well, he had to anesthetize the horse, but the owner couldn't help him and it was bleeding so much he couldn't see to stitch. So I needed to help him, and I had never done that before. I remember telling myself in my mind that the blood was chocolate just to keep myself focused because I was like, I have to help him. This grown man can't. I'm the only other one here. And it was very rewarding, and I decided after that I really wanted to be a veterinarian.
Yep, and that's amazing at 8 to be in that spot already, and that's wonderful. I love that we just said look at it as chocolate, so that way it's something.
My little
That
8-year-old brain was like, how do I not pass out? Because this guy over here is going to pass out, right? And I thought, I'm going to imagine it's something else. And then I'm
Yep,
just going to focus on what I'm supposed to be doing, wiping it away for the next stitch, the next stitch.
yep. No, I get it. So if funding was not an issue, what is one of the things that you would do to make a huge difference for the rescue dogs community? I don't know if it'd be a program or wherever
If
you want to take it.
Oh gosh, if I had unlimited funding to do whatever I'd want, the biggest the biggest challenge I see is in ERs. It does occur sometimes in day practice too. And
Okay.
one of my own dogs I rescued when I had a day practice, and an owner they were gonna have to put him to sleep because he had an expensive disease and he was in a crisis, and it was 2020, their income was down, they were young with a baby. They loved this dog, but they couldn't do what he needed. And I rescued him and he's mine now. But
Oh,
there are times when you end up having no choice. You can't do that all the time and survive financially. And in the ER, there's even more of that. And it's really devastating for veterinarians and staff members when you have to put animals to sleep that could be saved because you can't financially take them all on and you
right.
can't always find rescues for them. So if money was no object, I would definitely have a way. And some of it would be around because there are owners that are great owners that are this have this one-time thing. And I've done it before for an owner. I had a dog come in that had been attacked by coyotes and had massive puncture wounds in the chest. It was a little terrier. Also was, semi-comatose. Through all of this, I ended up doing so the owners adored this dog. When I called them to tell them it wasn't doing well, she was sobbing and she said, she only wanted this little dog, his first dog she'd ever had. And I thought, well, I'm going to try to save it. When I opened my practice, I'd been full-time ER for 4 years before I opened my practice. And so I knew that financially, her husband had a heart transplant. They couldn't afford it. So I said, all right, well, I'm going to do what I can. And I was just going to let them pay whatever they could pay. And ultimately, I did end up saving that dog.
That's
It
wonderful.
was crazy surgery because he had a diaphragmatic hernia, he had a puncture wound in the neck, had flail chest. I mean, it was a whole thing. It
Wow.
was a lot. Um, but they had that dog for another 7, 8, 9 years. And I mean, I asked, he wasn't on heartworm preventative when we started. So I said, one thing, if I save your dog for you, will you make sure that you keep your dog current and on heartworm preventative? Because I do not want this dog to die of heartworm disease if I do
Sure.
this. And back then, it didn't cost me as much as it costs now, right? But still, you can't do that all the time. You just because you can't pay your employees, you can't keep the lights on. So if there was a way that you had funding too to help these owners with, like after that, the dog got sick a time or two, they were able to pay for that. They never asked for discounts. They just couldn't afford that one big thing. You
Sure.
know, and there is some programs out there like that because I have a friend who practices in San Francisco and they have a citywide program that is grants. And the clinics that sign up, they can get a certain amount based on the size of the clinic, the number of animals. And
Okay.
then they so when they pick who they're going to help, and sometimes it's an animal they have to rescue and then find a home for. Sometimes it's an animal that the owner, just like that scenario, there's something going on that the owner can't afford all of that, but they can take care of the pet other than this one big thing.
Right.
And the clinic has to give a certain percentage, like 30% off, or so that they're giving too, because that way they're picking good cases,
Sure.
they're careful
Sure.
about what they're choosing. And then the grant money steps in and helps. So they're able to save some of those patients like that and help those clients that are good clients that have pets. And then if there's a pet that needs to be saved that the clinic believes can be saved and have a valuable home, they're not just having to euthanize them.
Right.
So love to see more like nationwide. But again, it's kind of like what you're doing. We need a way to do it where there's more funding than just donations, where there's money making, there's something in place that earns the money to help that so that it can be self refunding. You know what I mean?
Yeah, definitely.
Because the only way you can make it big enough is to find some way to do that. So that's what I love what you're doing because it is painful because you do have to sometimes because you just don't have endless pockets either. And it's painful if you want to save something and you know you can, but you can't because
Right.
you can't afford it and they can't afford it, or you can't find a home for it.
Right. And let me ask you this. It actually leads into the next question. You answered some, but how do you make that decision? Which dogs are the ones you can or can't help based on obviously there's finance, there's different injuries, things of that nature. Like how do you?
Well, so I guess, usually my gut instinct helps me, and my
Okay.
heart, which is, you know, and where I am with my pocketbook, obviously.
Sure.
But for instance, I had a dog come into the ER, and the story on this dog was it she had been at the rescue for almost a month. She was
Okay.
like a pit mix, super sweet dog. They were all really attached to her. It wasn't a rescue, it was a shelter.
Okay.
And they got the dog adopted. And of course, one of the things that they have in place is, you got to go get them spayed and they give you a voucher for it or whatever.
Right.
So the day after she got adopted, she was taken in to be spayed and she didn't know her new home or anything yet. And the new owner turned her out in the yard without being out there with her. And she's a fairly good sized dog, maybe
Right.
50, 60 pounds.
Okay.
And she found her way out of the yard and looking for, where she was before. And he lived in the town where the shelter was. So they came out and, helped him gather up and they explained to him she just had a major surgery, da 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 da. She shouldn't be out by herself. She doesn't know where she is. He turned her
Right.
out again by herself. And in her freaking out about where she was and jumping over the fence and trying to get away, she ripped open her spay incision. So part of her insides were hanging out of the spay incision.
Oh,
So
wow.
now this is a whole big thing. They bring her into the ER. She's so sweet. She's obviously a really great dog, and she's about 2 to 3 years old.
Okay.
And I knew we could save her, but the problem is that surgery is fairly expensive at that point. You've got
Right.
contamination into the abdomen, you've got stuff hanging out that you've got to remove without getting any more contamination. You've got a whole thing going on here. And the shelter could not afford to do the surgery.
Okay.
And they were going to have to take her back to the shelter to euthanize her because they, rather than pay us to euthanize her. And they
Right.
were devastated. And I knew she was a really good dog. And I just felt terrible. And the shelter's coming to pick her up. And I'm just a relief vet there. I'm not an employee. And the receptionist said, as we're getting the dog out, she said, I'd really love to have this dog, but I can't afford the surgery. And
Wow.
I said, well, I could do the surgery and pay for it, but I can't keep the dog. So
Right.
we ended up asking, the clinic if we could do that because obviously you've got to follow rules and protocols and all that. And we ended up being able to. I I stayed after my shift to do the surgery, and I spent most of the money I made on that shift to to pay
Thank
for the
you.
surgery. Yes.
Yeah.
And then she kept the dog. And the dog had a few challenges initially, but that dog was so good with she had a little toddler, like less than
Okay.
2 years old. Dog adored the baby. The baby adored her. So good. The dog did have some anxiety because it had been
Right.
rehomed a few times. And for a while it wanted to jump out. And she just put a really long lead on it and had it
Okay.
where she could put the lead on at the back door and it could run all around the yard and play, but it couldn't go over the fence. And it ended up with a really great home, a really great life, really great owners, and it was a blessing to them. But like I said, you can't do that every shift because you can't pay your bills, right?
Yeah. 100%.
And so that's the killer part is if there's one like that and you just can't. There was a puppy that came into an ER. It's about 4-month-old puppy, Shih Tzu, proptosed eye. So it's popped out, but I can tell it looks like most likely I can put that eye back in and save the eye
Oh,
when the puppy
wow.
came in. They were it was playing with another puppy. Those dogs kind of have bulgy eyes, like all the brachycephalic breeds, and they pop out pretty easy. And the puppy had not ever had any vaccines. It had fleas. It was a super sweet puppy. The owners didn't want to even let us just like get him to a regular veterinarian, which the puppy had never been to a vet. They just wanted to euthanize it.
Huh.
It's a 4-month-old puppy and it's super sweet. This is when I called my friend who does rescue. She does fostering mostly. She doesn't like
Okay.
own a rescue, but she works with a lot of rescues and fosters and does all kinds of stuff. And I'm like, man, is there any way you can help me? Because I was leaving in 2 days for my brother's funeral
Okay.
and there was no way I could take the puppy home, but I didn't want to euthanize it. And I'm like, I think I can save this puppy's eye, but for sure I can save the puppy.
Right.
And but I have to have a place for it to go. So she found a rescue. So what happened was I stayed after my shift and did the surgery and paid for the surgery. And then she met me in the parking lot at, some ungodly hour of the night after my shift and took the puppy to the rescue. And she paid for the veterinary stuff. So the rescue wasn't taking on money, right?
Okay.
Wasn't right. So she could get it in. And I got a picture 2 weeks later, perfectly functioning eye, stitches out. She paid for the vaccines. Puppy was going to its new home. But again, and thankfully, every shift you don't have stuff like that come in,
Sure.
but you have it more often than you can always afford to do it.
Right.
And
No,
that's where, if you're able to have, and that's where it has to be more of a, a step-by-step process. Like you've got to have a way to not only handle the medical part of it, you got to have a place for them to go so they can find a home. Because when they end up sitting in the clinics, like that same clinic had rescued a puppy and then it ended up with parvo. And of course, they took care of all that, but the expense that they
yeah.
go through, right? And you just like anything else, they can't be there to help other people's pets if they go under financially.
Right. No, that makes perfect sense. And sort of what you were talking about, and being that I'm newer to rescue, I've had Dodger. Well, his name was Jarad Dodger. Now his name is Kane. Um, He was fantastic. He had, do I say Socratic mange? Socratic,
Sarcoptic mange.
Sarcoptic mange. And had to put on all the medical gear, the booties every time I went in there. Just a ray of sunshine. Found him a forever home. That was fantastic. And now I have Max, so we were looking for his forever home. My question is, how do you know as a rescue, or what do you look for to make sure someone actually will be a good forever home? Any like signs to look out for that are negative signs or positive, I guess?
Well, I haven't done much on that part. My friend
Okay.
Debbie would be the one for you to interview for that because she's done all the fostering. My job has been to rescue them and get them somewhere where somebody can find them a home. And even in my own practice, I always knew that if I was rescuing them, I had to have a place for them to go so they could get that home. Because
Yeah.
a home that's full of animals, I mean, some people can take care of more than others. So don't get me wrong. My friend who rescues, I think she has five or six. My
Okay.
work schedule, that's not possible for me.
Right.
And right. And so in order for me to rescue in my business, I knew I had to have a place for yes, both of my dogs are rescues. One was a puppy that somebody was looking for a home for it when it was a puppy. The other one came in and was very, very sick. And the owners adored this dog, but could not afford to save it. He was devastated and in tears, and I didn't want to have to put the dog to sleep. At that point, I was like, oh my gosh, I knew my dog needed a friend. I tried a time or two to find my dog a friend, trying to foster dog and see if it would work. And it was because of the other dogs it didn't work, not mine. But I
Right.
still knew, I was like, okay, if I rescue this dog who's very sick, so I can't tell right now for sure if they're going to get along. But if I rescue him and I can't keep him, how on earth am I going to find him a home? Because he has a
Right.
disease that he's going to have for the rest of his life that has to be managed, that's not inexpensive. And I just had a gut level feeling that it would work. And so I rescued him. And while he was in the hospital, and my little dachshund at that time, long haired dachshund, came to work with me every day.
Right.
And he would immediately, the dachshund was running over to the rescue, the boxer mix his um, cage and checking on him. And then when
Oh,
the boxer mix, when we take him out to go to the bathroom, he wanted to go to the office to check him. And I was like, I just had a feeling. And when I brought him home, he still wasn't completely regulated. And
right.
he wasn't feeling well one day, and my dachshund kept bumping his nose against my calf and then running to Kramer like, mom, there's something wrong. I'm like, I'm on it, Jax, I'm on it.
That's great.
It was so
Yeah.
funny.
They just built
They're
that
really good
bond.
friends. Yeah, they get
They
along
just built
great.
that
And
bond.
it's yes, it makes it much easier because now I'm traveling more, but I know they're happily at home and I have fantastic pet sitters when I'm gone. So
Right.
yeah.
Well, that's great. If you could put preventive measures at a rescue or shelter to implement, what were one or two that you would do that you think would make a big difference?
What do you mean? What kind of preventative measures at a shelter?
Anything else that they might be able to do? Like, for example, um, let me think. They have, just like how you have the heartworm pills to prevent heartworm. I'll give, here's a good example. So what I've noticed is with the rescues, until they're pulled or they're adopted or fostered, they don't really do the neutering. They don't do the spay, things of that nature. So there's some preventative things they don't do. And I didn't know if there's anything that comes to mind that could be added that would help.
Well, the reason they don't is because they can't afford to, in all
Right.
honesty. They have to have a place for them to go before they spay and neuter. Can you imagine the cost if they spayed and neutered and then euthanized?
Yep.
And
Yeah, it's a
I
lot.
hate that, but it's still a reality right now.
Yep.
Wish if there was some way they could vaccinate as soon as they came in before. The hard part is vaccines, it's not very practical, which is why it's not happening, is that it takes 7 to 14 days for vaccines to fully kick in.
Okay.
When you rescue an animal off the streets and they already aren't vaccinated and they've already got some exposure and risk, right, of breaking with things. So ideally you'd vaccinate them as soon as they came in the door and you'd isolate them. But from a
Right.
financial standpoint of view, it's just not possible to do that.
Gotcha.
So you end up with more diseases running through the shelters that it's hard to control that.
Gotcha. So they're on it, and it really comes down to the same thing as always, funding. You
Yeah.
know, if
Well,
you could,
and of course, the more we can speak of spay neuter, and get more people to spay, right? So we don't have so many animals. And
right,
obviously, certain areas of the country have more of that than others. We deal with it rampantly here in Texas. Whereas, in the Northwest, they don't have near as much of that. That's why some of our rescues transport pets there for
yeah,
adoption, right?
yeah,
Because they have less, they do a lot more of the spay neutering and there's less stray dogs.
right,
And I think that comes down to cultural differences.
sure,
We have a lot of different cultures in the state, and some of those cultures really don't, they didn't, they grew up not spaying and neutering, and basically animals, dogs and cats didn't live as long. They just sort of
right,
lived and died on their own. And as we take better care of them and they live longer, you just keep having more and more of them.
right. And with your knowledge, if you could tell a dog owner, could be a new dog owner or just a dog owner, to communicate one, two, maybe three things that they need to know that you see when they come into the office that could make them better owners. What are a couple of those if you can think of any?
Honestly, I would look at, making sure you do preventive care, but that's kind of anybody in animals, like, yeah, because you hate to see them get a disease that could be prevented, right?
Right.
But making sure, so we are seeing a lot of anxiety in pets now. And I think a lot of it is they're just not getting enough mental stimulation and exercise. And
Okay.
then they're developing anxiety out of that. I think that's where a lot of the separation anxiety is coming from. And so it's really important to make sure, and every animal is different. My dogs are very, very different in terms of what they need for to be happy mentally.
Right.
The bigger dog does not, he hates car rides. He loves people, but they have to either come over here or we meet him out walking. He
Right.
doesn't want to go somewhere. My little dog is super smart and needs mental stimulation. And he used to go with me to work, and I guess he got a lot more mental stimulation from that than I realized.
Right.
Because now as I'm working from home more, I've discovered that I have to do things with him. Like, he's now advanced trick certified. I
Oh,
tried no
wow.
with him and he loves it, but it's hard for me because he needs a lot of at-home work that I don't have time for. So my next goal is to get him and do barn hunt with him,
Okay.
because there's a facility nearby that does that. Agility is good. There's so many different activities, but making sure your dog is getting, and little things like when you go, sometimes people don't realize a walk is a big difference over going in the yard, because the yard doesn't have different smells. When they
Okay.
go out on a walk and they smell other smells, they those release endorphins that are really, really good for their brain. And so walking different ways, going in different and giving them time to sniff. So when I do my walk, I take the dogs, and we actually often do several shorter walks, but I always like set my clock for the walk, and then I put pause and let them stop and sniff, and then I restart them, so that it's beneficial to them too, because they need that sniff time and that stop time,
Sure. No, no, that
right?
makes perfect sense. Yeah. I had
And
taken
the other
out.
thing
Oh, go
is
ahead. Yep.
making sure you do a little bit of discipline, that they have basic manners. Because when they don't, what happens is it's hard on them when they go to the vet, because they fight and struggle, and then it makes everything harder. They start to get, and there's fear free, which is about helping the pets have a better experience at the vet clinic, which I love. But
Right.
if they have the basic training and you've worked with them, then all of that is not so scary to them.
Right.
And when people don't, when they don't have those basic trainings, and then you have animals get older and they need medication, and the dog bites and they can't give them medicine, and this is all stuff that we can't really fix when they're 12 years old, but it's something we could have done something about as a young dog, that would have made a big difference in your ability to give them good quality of life as they get older.
Yeah, that makes perfect sense. Um, are there any new innovations in the last 5, 10 years in the medical part of veterinarian or dog, whatever it might be, that have made a big difference health wise?
Well, we can save a lot more dogs than we used to can save. It just comes with a price tag. So if you can do insurance, if you adore your dog and you're able to do uh, insurance, I would highly recommend it. I
Yes.
have insurance for mine because I don't want to have to make, if there's something that we can, if we can actually save them and they have good quality of life, I don't want money to get in the way of whether I can
Right.
do that or not, because I've seen it so many times, right? Because we are learning so much more, like what we can do in the ER. I've been a veterinarian for 31 years. What we can do now in the ER and in critical care versus what we could do 30 years ago is incredible.
Okay.
Um, and yes, we have drugs. We can save cats with FIP now, but that medication is new and it's expensive right now. But I've seen cats saved from it, and used to FIP was an absolute, you couldn't save them. They did not make it.
What's FIP for? I'm mostly a dog person. I love cats.
Feline infectious peritonitis.
Okay, perfect. Thank you. Yeah.
But yeah, there's no vaccine for it, and it's
Right.
it's it's not been something we could save them from, and now we can. So it's really cool, and we have a really cool injection that you can give if they have parvo that really increases their survival time. And it's an
Oh, wow.
expensive injection, but a lot of times it saves a lot of money because those dogs, we're seeing them go home in 12 and 24 hours if it's given early in the disease. And whereas they used to be hospitalized for, and still are if they don't get that shot, 3 to 6 days, sometimes longer. You don't know how long it's going to be because the virus itself, you're trying to support them through the virus, and they're developing all these secondary issues from the virus, and you can't predict what all that's going to be. And so it's very expensive to treat parvo usually. And it's rare for us to be able to save them if they're not hospitalized and treated aggressively. It can happen, but a high percentage of them don't make it. That's why, the vaccines are so amazing and awesome. But, if people don't get those vaccines, or they're coming through a shelter and they've been exposed before they got a chance to have those vaccines,
Right.
then you're trying to figure out, how to save them.
Yeah. Yeah. I do the same thing as you. I have Embrace insurance for Soleil. And when she was probably 6 to 8 months old, all of a sudden she had a little tumor on her head. And with everything, the plan that I picked at Embrace is up to $15,000. There's $200 deductible, and then you get 90% back. And they have different plans, so you can do it however you want to do it. But a $1,700 surgery cost me the $200 deductible and then the 10%. So I think it was like $350.
Yeah.
And you know what I mean? And up to 15,000. It's something that when I see it go out of my account every month, it actually makes me smile because we didn't need to use it, if that
Yeah.
makes sense.
Yeah, no, yeah. And I haven't even filed for the little things on Jax. If he had to have a back surgery or some sort of
Right.
treatable other disease, that needed an internist or somebody, not something simple that I would be doing. I wanted to be able to not let money get in the way of the decision.
Yes. No. And from the stories I hear, the prices are very expensive. I'm not saying they're overpriced, but I'm saying it just costs a
Oh, it
lot of
costs a
money.
lot to do that kind of
Yeah.
medicine. It just does. Like we're actually doing for a fraction of the cost what gets done in human medicine,
Right.
and for the level of education and training that we have, we don't make anywhere near the income of other professions it's not overpriced. It's just that now we have the ability to do those things, but
Right.
you can't have the equipment and the knowledge. There's a lot of expensive stuff that goes into doing that kind of medicine. Like
Right.
not just the drugs, but the training, the amount of training the tech staff has in the ER. Like
I didn't even think about
I
that.
did,
Yeah.
yeah, I did a surgery in the ER, and the dog had towel from its stomach all the way to its colon. And that's complicated, and there were multiple incisions, in this one in the stomach, but multiple in the intestinal tract, and it had been in there for 5 days, so there was a lot of trauma to the intestinal tract. And somebody asked me, "Oh, did you do that surgery at a day practice?" I'm like, absolutely not, because even in my own day practice, we just don't have, the techs don't have the level of training, and
Sure.
you don't have the extra, you yourself can't afford, because you don't see those surgery, the ER is doing that type of surgery on a regular basis. So
Right.
they have the drugs that you need if the blood pressure's dropping, and the extra warming things, and flush all the abdomen to flush the abdomen, and everybody knows what's going on, and you have all this tool. It costs a lot more to have those things. You can't keep them on hand and have them go out of date because you're not using them. And
Right.
so I didn't do them in my own day practice. After I did initially, because initially I had an ER tech and I just come out of ER medicine, but over time you get too busy and you can't fit them in your schedule.
Right.
And better for the pet to send it to the ER where they're set up to do that. The staff is trained to do that. Everybody's doing that on a regular basis. So even though I could do the surgery, it still matters where you're doing the surgery and what sort of equipment and drug, because it requires different pain medications, different IV drip procedures for pain, all kinds of things.
Right. And if you could tell me your favorite success story from the practice or rescue, whatever it might be, that stands out to you the most that you were part of.
Oh gosh, really, truly, it goes back many, many years. My very favorite success story was this little terrier. I mentioned it to you before we started, but this little terrier that came in, they had gone to the ER, but it was almost closing time at the ER. So it came to me just with a chest wrap on, but it had been attacked by a coyote in their yard, and they rescued it out of the coyote's mouth. And it had it had pneumothorax, which is air in the chest from broken rib that needed to be fixed. Had a diaphragmatic hernia, which is means you have to go in through the abdomen. So that's two different things. Had a puncture wound in its neck, and it was semi-comatose. And so it was not conscious and aware when it came to me in the morning. And by the end of the day, so I couldn't do surgery on it because there's no way to do anesthesia at that point. By the end of the day, starting to wake up. When I called the owner to tell her it wasn't doing great, she was sobbing and she just said, "I love that dog so much. I wish you could save that dog." And I just had this lump in my throat. And I said, "Well, I'll give it a try." So I had to take it back to the ER. I drove it back to the ER myself that night, and I told them that the bill was going to be on me.
Okay.
By morning, they had put it on suction because now it was breathing hard enough. It was sucking air into the chest, and it was conscious enough to do the surgery. Sent it back to me with the suction for us to have because I didn't have one at the clinic. And we did the surgery that day. So it was really multiple days. It was several hours in surgery because we had to close the flail chest so air wasn't going into the chest, put a chest tube in so we could suck the air out so the lungs could fully inflate, close the diaphragmatic hernia, which was an abdominal incision. When we got almost done with surgery, vomit was coming out of this hole right here, and my tech was freaking out. And I said, "You know what? I'm going to believe that that came out of the esophagus, didn't go down the trachea. I'm not giving up after we've gone this far."
Sure.
So we had that suction from the ER. We suctioned out the mouth to get all the vomit out of there so the dog wouldn't aspirate when it woke up, right?
Right.
We're creating this as we're going, figuring this out. So we suctioned all of that out, woke the dog up. And then I took care of the dog for several days, and then the dog was improving, but it had this little, what's called nystagmus, where the eyes are twitching. And I,
Okay.
and it had been a little nauseated. It had been hard for me to get it past the nausea. So I called the owners and I said, "Hey, just by chance, because I'm like, did this happen when the coyotes attacked it?" And they go, "Oh, we found this dog in a ditch and she had a stiff left leg and rear leg and her eyes were twitching, and they've always done
You've
that."
always done it.
And that little
Gotcha.
dog had the best personality. It totally recovered. The owners just paid me whatever they could at the time. The male owner, they were an older couple, had had a heart transplant, and
Right.
so and had cancer a couple of times from being on the immunosuppressive drugs for that. That little dog lived, oh, I don't know, at least another 7 or 8 years. The woman actually eventually passed away, and the grandfather and his grandson would come in with the dog. The only thing I asked for them when I had dog leaves, and they were able to take care of all the other bills. It had a kidney crisis at one point. We got it well from that. They took care of all of that. But if I hadn't saved that, I mean, they got years with that dog, and that dog had a wonderful life. And so that is just, we took risks. We did things we had done to just see if we could, we knew enough because my tech at that time had been an ER and I had been. but it's still, we didn't have a ventilator. She's ventilating while I'm doing this surgery. Like it was, and we saved the dog and it had a great rest of its life. It was probably 6 or 7 when that happened. And then
Right.
it lived a full, long, normal life after that.
That's awesome. I love that. Um, the success stories are important. But one thing that you look at and see on social media and things of that nature are all the negative, it's not even negative, but the emotionally draining heartache of with what the dogs are going through. So whenever I'm able to put or see a success story on social media, makes me feel so better, much better. And with your background, I'm wondering your thoughts because the shelters and everyone what they really talk about is saving dogs, saving dogs, saving dogs. But nobody ever talks about the fact of that saves humans and the mental health crisis. You're talking about PTSD, you're talking about loneliness, and those things change a person's life. And I wish that there were some more of those success stories and there was more focus on that because that it's the reality. What's your take on that?
Well, I mean, that's why I saved that little dog, the woman on the phone that said, I don't want another dog. I want that dog. And I was
Yeah,
like, you know what? I'm going to see if I can make that happen.
yeah.
You know? And she got to have that dog.
And
And
it worked
that,
out.
and every time they came in for, it filled my heart up every time I saw them together, you know.
Yeah,
Uh, and that dog lived a great life. And, he lost his wife. He still had his little dog. Um, so, so yeah, the mental health dogs are incredible for us. And I mean, there's several dogs I rescued through my practice. Like one dog that they weren't even my patient to begin with. Somebody that knew me called me and said, "Hey, that someone they were related to had passed away and had a dog that had juvenile cataract, so it went blind at a young age. It was the dog at that point in time was 3 or 4,
right.
and they wanted to euthanize it because nobody in the family wanted it. And I said, well, I won't euthanize it, but I will take it and find it a home. And I found it a home with one of my clients. That dog was brilliant. Like it learned to go up and down the stairs, go in and out of the doggy door, and it had a great life. And it lived to be really old. That dog lived to be 17 or 18. And
Okay.
it was my patient for the rest of its life, and it was beloved dog, well taken care of, and that dog deserved to live. It didn't deserve to. And it gave, two people, so much love and care and life from
Yeah.
having that.
Yeah, and that's exactly my point. That should be on success stories. That should be on social media. That part of it as well, because I think a lot of people they look at the rescue and want to do it and just don't take that step to move forward. And with that, and I'll get to this in a second, but with the human's take on it, big difference. Now, how do you handle and make it through your day when you're having all the challenging, sad things that are happening or seeing in the rescues, all the tough things to see? What do you do and what do you recommend to people to do to be able to keep on going and keep fighting?
Honestly, I think you have to focus on the ones you can save. Um, and then be as loving and compassionate as you can to the ones that you can't, right? Because at the end of the day, you won't be able to save any of them if you get bogged down in the sad stories. That's the bottom
Right.
line. Because you won't be able to function well enough to do that. And so you do have to learn to choose, save the ones you can,
Mm.
be as kind and compassionate as possible. I always try to find a way for the owners too, right? So when ERs are expensive, they are expensive to run. They're having to pay people to work nights, weekends, and holidays. They have to have people who are far more trained than in a general practice. All of their staff, their technicians, all of their staff have to be more trained and work, some tough schedules. And so and they have to have a lot more expensive meds there. They have to have a lot more different things there that can expire. That all goes into your overhead expense. And so I always try to preface people and prep people with, if we offer you gold standard first because legally we need to do that. And you need to know what that is. If I don't offer it to you, then it's like I'm choosing for you.
Yeah.
But if this isn't going to work, let's see what we can figure out. Let's do what we can. And sometimes that means sometimes people will tell you they can't, and then when the animal's not getting better, they'll find a way and come back. But first they need to, because it is a big decision. And you know people have kids and mortgages and other things that make it hard for them sometimes in certain situations. And you may know in your heart of hearts, this dog really needs to be hospitalized. And but if they're not ready for that, you figure out what can I do, and then make sure they have the opportunity to come back if the dog isn't getting better and it's still the weekend. Or is there something I can do to get the dog to a day practice that's less expensive, and you're always thinking about that. How can I help the animals and the people? Because they do go together and they do matter.
I agree. And we talked a little bit before we started the interview about what my goals are with Paws Saving Paws. And what I think that is driving it more is if we have the indoor dog park, there's in San Antonio alone, there's 203 days that are non-dog park friendly. I did a whole weather analysis by day, by snow, by temperature, so I could figure out, the likelihood of success based on how many days they would need to come. And what I want to be able to do is when I use the front of house, like we talked about a little bit, like the boarding, the training, the merchandise, the um, coffee house as well. We want to make that a big difference and be able to save more dogs and have the other half of the location be a rescue. And one of the things is I want to build an actual rehabilitation program. So that way, when they're with us, they're getting trained. And I know in some places they do training, but I've focused on training. There'll be a outside, not outside, an indoor dog rescue park. So they'll be able to play for 3, 4 hours a day versus being in the run for 23 hours and 45 minutes. And those types of areas. And I want to bring down the days to adoption, increase the retention rate of forever homes. And that way, with the same space, you can treat and help and save so many more dogs. And that's
One
my
thing I would
vision.
say is you're going to need to be super, super careful
Okay.
between the boarding and the rescue because you
Yeah.
don't want your boarders to get sick from something that the rescue brought
Yeah.
in.
Yeah. And it'll be 100% separated.
Yeah,
So
yeah,
they,
but cleanliness wise, people wise, you're going to really have to
oh,
develop
okay.
good protocols for that.
Okay, perfect. When we get
Yeah,
there,
yeah,
I'm going to
because
be
you may
calling
have
you
some of
back.
the same staff. Yes, I'll be happy to help you with that because that will be an important part of it, And if you're bringing them in from a shelter, you probably want to have an area where you quarantine them until they've had the vaccine for a certain amount of time because you don't want to get in a situation where you have it running through all of your rescues either,
Right. Yeah.
right?
No, it makes perfect sense. Yeah.
Yeah,
So,
yeah, you may have to have a number in, a number out, right? So that you
yeah.
can manage all of that. I mean, because you want to save all the ones you want to save. You don't want to end up in a situation where you're trying to save too many and then you end up in a situation where you need to euthanize a whole bunch because you've got something running through your shelter that you can't stop and it's getting into the boarding side. So there's some
Right.
things, yeah, there's some things around that. But I think it's fantastic because you do need something that, and if you have people coming in and using your facilities and they know it's all going to rescue, you're more likely to have people that will help you create fundraisers and donate and do things because they enjoy the side of it that's meant for, customers. And
Right.
so that's huge.
Yeah, and like I was saying, the whole thing will be separated, but there'll be a big window. So when people are coming in, they can look through the window and see the rescue dogs playing versus walking through the dark buildings, seeing them all sad, shaking. And people want to see good. A lot of people emotionally can't handle going to a shelter. Um, and I've taken so much of your time. I want to just, if there's anything else that you wanted to add before we wrap up, and again, I wanted to just tell you how much I appreciate you taking your time out of your day. It means the world.
Oh, absolutely. And like I said, I'll be happy to help you when you get to that stage and you're figuring out how to do things. Um, to keep it, try to keep it where you don't have disease between the two.
Right. Cross-contamination, so to speak.
Yeah, yeah, because some of the diseases are more contagious than others, and like parvo lives in the environment, and it can be you can track it in your shoes or your clothing into another area and then have a hard time getting rid of it. So
Okay, gotcha. Yeah, see, and that's why, like I said, started about 2, 3 months ago. And building, I'm learning so much from you. I learned a ton today from the other networkers and rescues. I'm learning so much. And it's such the thing that I love is I'm part of a community right now of people working together to save lives.
yeah,
And it gives you that purpose and that you're really making a difference, you know?
yes, absolutely, absolutely. It's
Did you
it's
want to add anything before we end up?
I think what you're doing is amazing, and animals are such a precious part of our lives, and anything we can do that helps save animals that are meant to be here helping somebody. And I do believe that, you know, that little dog, I'm sure the puppy found a perfect home that was meant for it.
Right.
And they serve so much purpose for us in showing us unconditional love and resilience and kindness. And so anything that we can do that helps save them and get those beautiful beings with people, um, that they can lift up and support those people is it's just fantastic and magical.
Yep, I couldn't agree with you more. Again, thank you so much for your time today, Dr. Lucette. I look forward to seeing you in the future and getting guidance from you and learning from you. And I just am very appreciative for everything you've done, the stories you shared, and your big heart for helping as many dogs as you did is very impressive. And like I said, it makes my heart feel good.
Well, it makes my heart feel good too, and it's part of what I love about veterinary medicine.
Right. Got it. All right. Well, you have a great day, Dr. Lucette.
You too. Thank you.